Well, we are going to move right on here. I'm very pleased to have Julie Rovner here. She's a friend of NPF. She's spoken for us a number of times before. She is now the Robin Toner Distinguished Fellow at Kaiser Health News after spending a long career, 16 years, as the health policy correspondent for National Public Radio. She also has written a book, Healthcare Politics and Policy A to Z, and you've updated that a couple times.
A couple times. It needs updating again, but it's on its third edition.
Third edition. She's also a winner of the National Press Foundation's Everett McKinley Dirksen Award for coverage of Congress. This is one of the most prestigious awards that our organization gives every year, and Julie was a recipient of it, I think, for coverage of Medicare Part D, the prescription drug part of Medicare, and you also, of course, covered the rollout of the Affordable Care Act,
and
you're still covering
creation thereof.
Right, so that's been a long slog. Previously, she wrote for the Congress Daily, for Congressional Quarterly.
Maggie was my editor for a while.
Okay, well, the gang's all here. So Julie now is going to talk to us a little bit about the history of vaccines and the controversy around vaccines. You may think you know this story from a sort of superficial level, but I think we're going to get a lot more detail, and it's really fascinating. So Julie, thank you so much.
Actually, even I thought I knew this story until I actually started putting this together, and I realized there were things that I didn't know. I should tell you that a good deal of this is cribbed from my book, Healthcare Policy and Politics A to Z. I'm
going to give you this. I don't know if you'll need it, but if you're going to use it, you have to speak right into it.
Can you guys hear me without it? Do you need me for taping purposes or anything?
No, we're good for taping.
I tend to talk loud. It's a radio thing. A good deal of this was cribbed from my book because I am old enough to have covered a lot of this stuff. I've been covering this on and off since the 1980s. So a lot of this I actually lived. It's never been a primary focus of my work, but public health has always been a piece of my beat. So I actually sort of come by this kind of honestly. It is. Let's put it this way: I have not been vaccinated against covering vaccines. And one place that I will suggest to you before we even start is a website maintained by the College of Physicians of Philadelphia, which has a really wonderful sort of history of the whole vaccine controversy, and I followed way too many links from there putting this together. But I'm going to be relatively brief and relatively wander around, so interrupt me if you like with questions, and we'll have plenty of time for questions at the end. My story, at least my piece of the story, begins in the 1980s. This was a time when the drug industry was flush, some things don't change, and an era of new blockbuster drugs. Things like statins and proton pump inhibitors and antidepressants were just beginning to emerge. These are drugs that people take for a long time, if not every day, for the rest of their lives. They make a lot of money. What didn't make a lot of money? Things like antibiotics and vaccines, other things that don't change. And in the case of vaccines, there were a small number of serious adverse reactions that had led to lawsuits that had found manufacturers liable. I won't go into all the details. That actually goes back to the polio vaccine. But the result was that drug makers increasingly were getting out of the business of making vaccines. By 1984, only one manufacturer was making the vaccine for diphtheria, tetanus, and whooping cough. I think it was Lilly. I can't remember. But the ensuing shortage was so severe that the CDC actually asked doctors to delay boosters for older children so what supplies there were could be focused on infants. In an effort to ensure the continuing supply of vaccines for children, Congress in 1986 enacted the National Vaccine Injury Compensation Program, usually known as VICP. You will see this around. Someone described this recently as a hidden, unknown program. It's like, really? No. There was a big fight when they passed it in 1986. The program was intended to help alleviate the liability concerns of the vaccine makers and give families of those injured by the vaccines a simpler, faster, cheaper, non-court remedy. The idea of the VICP is simple. It establishes a 75-cent tax on vaccines recommended by the federal government's advisory committee to create a fund to pay victims of those rare adverse reactions. It also maintains a table of known effects. Those who have suffered so-called table injuries, meaning injuries that occur within a set period of time, certain injuries, they're presumed to have suffered it due to the vaccine. They don't have to show any more proof. Compensation is set according to the severity of the injury, Those who suffer non-table injuries can present medical evidence to a court-appointed special master who determines whether or not the vaccine was responsible. As of early this month, just under 4,000 claims have been paid for a total of $2.8 billion. That's since 1989. Pre-tax claims had a separate grouping. The average award's about $750,000. Awards for deaths related to vaccine are capped at $250,000. Those claiming an injury from a covered vaccine must first pursue a remedy through the program. This is how they were trying to assuage the liability concerns. If they pursue that and get an award, they are free to reject that award and go to court, but those who do accept the award give up their right to sue. In 2005, the program was extended to cover the flu vaccine. It started out just childhood illnesses. So now anyone of any age who's injured by a covered vaccine, not just children, can apply for compensation. The program worked pretty well until the early 2000s, when parents began claiming their children's autism was caused by vaccines, or by a preservative called thimerosal, which has since been discontinued in vaccines for children, although it's still used in the flu vaccine. I assume you all know the whole thimerosal, a little bit about it. Their claims were buttressed by a now thoroughly discredited 1998 study that appeared in the respected British medical journal, The Lancet, by Dr. Andrew Wakefield, a British physician. The study suggested a link between the measles, mumps, rubella vaccine and bowel disease and autism. It took several years, but the study was eventually retracted, though not until 2010. Dr. Wakefield was stripped of his medical license in Britain after it was found he was actually working for lawyers who were pursuing vaccine damage cases. So it should be like that study never existed, but it's not. The damage was done. Despite now dozens of studies showing no causal link between vaccines and autism, fear of vaccines in general and the MMR vaccine in particular began to spread more widely than ever before. Now, for a moment, I'm going to step back and point out the anti-vaccine movement is nothing new. There have been anti-vaccine activists since the days of Edward Jenner, who invented the smallpox vaccine in the late 1700s. Some of the objections were religious. That vaccine, after all, came from cows. Some were doubtful of the efficacy or of medicine in general, which was not totally unreasonable back then. And some of the objections were simply libertarian. People should have the right to decide what to do with their own or their children's bodies. The Anti-Vaccination Society of America was founded in 1879. You can Google it. Anti-vaccination groups in Britain obviously go back further than that because they had mandatory vaccines well before. Anti-vaccine forces also led to one of the most important court cases for public health. In 1905, the Supreme Court ruled in a case out of Cambridge, Massachusetts, that was challenging mandatory smallpox vaccination, that the state could pass and enforce compulsory laws to protect the public health from communicable diseases. I don't know how many of you watched The Nick, which is a fascinating Showtime series about hospital medicine in the early 1900s, but there was a long exchange about Typhoid Mary, and who actually went to court and tried to get herself freed, claiming that she wasn't sick and wasn't spreading disease. So this all stems from that 1905 Supreme Court case. In any case, Jenny McCarthy, the former Playboy model, who's now become the face of celebrity and anti-vaccine advocates, is nothing new. Anyway, let's go back to the federal vaccine program for the moment. As I'm sure you've heard today, this is not the first measles outbreak we've had since the vaccine became available in the 1960s. In the late 1980s and early 1990s, there were hundreds of cases of measles around the country. But what differed between that outbreak and the one we're having now is that, yes, many of the cases were in unvaccinated children, but they were unvaccinated for reasons other than that their parents didn't want them to be. In some cases, it was cost, because the families were uninsured. In some cases, it was cost because they had insurance, but the policies didn't cover the vaccines. And in some cases, vaccines were simply difficult for parents to access. So in 1993, during that last little tiny window when Democrats controlled the White House, House and Senate, Bill Clinton was president, for those of you too young to remember, Congress passed the Vaccines for Children program. This was actually part of a big budget reconciliation bill that passed that year. This in some ways nationalized the supply of childhood vaccines. This is also relatively unknown. But every child is now entitled to vaccines against all the preventable diseases that are on the list of the Advisory Committee on Vaccine Practices without cost if they're uninsured or if their insurance doesn't cover it. program is run by the CDC. It distributes vaccines to state health departments, who in turn distribute them to doctors' offices and other clinics. That was supposed to take care of the problem, that and VICP, except it didn't. As I mentioned, now parents were starting to be worried about vaccines and autism. In 2002, the autism cases were consolidated into what was called the Omnibus Autism Proceeding. It was actually 3 test cases to see if there was a possibility of developing enough of an evidence base to provide damages through the vaccine compensation program to children whose autism was diagnosed following the receipt of vaccines, particularly the MMR vaccine. There was a lot of concern at the time that this could theoretically destroy the program because there were so many children with autism that they would basically run out the entire what was there in the fund for the program. But in short, there was not. In 2009 and 2010, special masters of the Federal Court of Claims, which is who adjudicate the VICP cases, ruled that autism could not be compensated from the VICP. Some of those cases are still in court. I imagine you'll be hearing more about that in the next session. But all of this has not stopped parents from believing that vaccines can cause autism. Of course, there's no way to prove a negative, which doesn't help. But what we do know is that children who are not vaccinated are not only at risk themselves, but put at risk those who are either too young or too immune compromised to be vaccinated. So as you see, this latest measles outbreak is just one more data point in a very long and ongoing battle, and it probably won't end anytime soon. We can open it up for questions.
Anything about what's causing the rise in autism? I mean, people, they're always telling me, a lot of people, inform me, it's really because we can identify it better now. But does that really account for this huge number that we're seeing? I mean, do they know anything? Some of it is that more children are being diagnosed, right.
But some of it is we don't know. One of the things we're pretty sure we do know is it's not vaccines. Which doesn't mean that it's not something else. I mean, there's been all these theories about, maybe it's not this vaccine, maybe it's all the vaccines together, it's too many vaccines. This is the big fight that pediatricians have. There are now 16 vaccine preventable diseases on the list, I think, and and several of them come in multiple doses, and parents worry about giving sort of that much vaccine to infants at once. But this has also been studied, and there has been no evidence. I mean, other than the now thoroughly discredited Wakefield study, there really has been no evidence of any kind of causal link between vaccines and autism. The problem is the coincidental link, which is that kids tend to get diagnosed with autism about the same time they're getting vaccinated. So people try and put things together and say that one is causing the other, and that's I'm sure you all know, is the famous logical fallacy that correlation does not equal causation. So it is difficult, but there are lots and lots and lots of studies. I mean, autism is a serious problem, particularly with autistic children who are growing into autistic adults who will have to be cared for for their entire lifetime. So obviously it's a societal problem. It's not just a problem for the families. But as far as I know, we don't know. We don't know, right?
Do we know how big is the surge? Are we looking at, since we kind of
it's big. I think the last time I saw a sort of 1 in 9. Now, obviously, we now have what's, the autism spectrum. That's right. So some children are much less affected than other children. But, one of the stories I did several years ago is NPR was doing a series on how Europe handles healthcare, and I actually ended up focusing on how the differences between, I went and looked at the Swiss healthcare system, which is similar to what we have now, but they handle, long-term disability much differently. It's all handled by the state. It's all taken care of. I went and visited, actually, it was an American mother and a British father with a 16-year-old autistic daughter, very severely autistic. We went and visited. She goes to a private school where she lives during the week and comes home on the weekends. When she graduates from school, she'll be able to stay there in a sheltered workshop. I mean, it's basically all taken care of. When she's home, they have help, handling her and with, even with household chores. Then we went up to Gloucester, Massachusetts, to a family, a fairly wealthy family. Father was an executive in a biotech firm with 2 autistic teenagers. At that point, I think they were 17 and 19. And they, of course, got very little from the state. Once you turn 18, in a lot of cases, the state doesn't provide, they're required to provide education services, but they're not really required to provide very much. And they had actually bought an old convent with the hope of turning it into a small home for 6 or 8 severely disabled, young adults. That was their idea, because they were worried about what was going to happen to their daughters when they passed on. Obviously, they were in their 40s and 50s, and the girls were, this is not, the thing about a lot of severe disabilities is that the life expectancy is short. That's not really the case with autism. So it's a big problem, but it does, linking it to vaccines, then you end up with autism and measles and whooping cough and, other things. Yeah.
You said that in the 1980s, pharmaceutical companies were kind of getting out of the vaccine business because it was not profitable. What is the status today? Are vaccines generic? And how is that related to any recent news about shortage of some vaccines?
I think the vaccine market has stabilized again, partly because the government has guaranteed the market. I mean, that was the bigger problem right now is with antibiotics. There's a big shortage of antibiotics and of research into new antibiotics, which is in some ways a bigger problem because you have superbugs, and I think there was another one last week that we read about at UCLA. And we need new antibiotics, but again, people take antibiotics until they get better, and then they stop taking them. I mean, even vancomycin or some of the ones that are really expensive are not that profitable. So it's very difficult. You'd rather research something that's going to be the next weight loss drug or something that people have to take indefinitely. But the vaccine market is, compared to the antibiotic market, the vaccine market is very stable. Compared to to the market for other things, maybe not so much. But I think that some of the vaccine shortages we've seen have been more of a supply, a manufacturing supply, rather than not enough companies making them. Flu vaccine is different from the rest of these. Flu vaccine has to be made whole from scratch every year. There's a committee that figures out what the predominant strains of flu are, and then basically they order up the vaccine. They say this is what the vaccine should protect against. Here's the strains that we think will be circulating next year. This year they were wrong, in fact, which happens every few years. It's not an exact science. So I think this year's flu vaccine only covered 20% of the flu strains that were circulating, which is why a lot of people who got the vaccine got the flu. Although I get a flu vaccine every year. Again, that's why I have to get it every year, because it's different every year. So that's not the same. But vaccines, the MMR vaccine and the DPT vaccine and the Hib vaccine, I mean, those are the same, and they continue to be.
So are they generic?
They're not generics. There's no generic market. They're technically biological. So I guess now with the Affordable Care Act, there's a market for generic biologics, but I don't think anybody's going to use it on a vaccine. They're going to use it. I mean, the market for generic biologics are for these incredibly expensive cancer drugs, not for. But technically, there is no generic. On the other hand, they're not. It's not. It wouldn't make such a difference to price the way a generic statin or something that you do take all the time, or high blood pressure drug. All those drugs you're going to take for a long time, and if there's a generic and you can cut the price, that will make a difference. You don't get that many vaccines. You don't, with the exception of the flu shot, you don't get them every year. So
essentially the reason you said the market stabilized because of the requirements.
Well, and because the government basically buys up not most, but the government buys up a considerable supply of the vaccines that are made, and then distributes them back out. So there's a guaranteed market. So you're going to make some money. I mean, most of the companies that make vaccines make other things. I don't think there's that many just vaccine makers. They're the big drug companies that make them.
Mm-hmm. And just to follow up on your remark about the antibiotics, I've read that people are taking too many antibiotics, and doctors are prescribing antibiotics when they don't really work. So, but you say that there needs to be more research into antibiotics for.
Oh yeah, you could do a whole day on antibiotic resistance. It's a whole different. But I'm just pointing out that that compared to in the late 1980s, everybody was worried about vaccines, and today everybody's worried about antibiotics.
Thank you.
Jumping off kind of the flu, I know that states report children's rates for deaths of the flu. And I also know, just because I've read about it, that seniors have been hit really hard this year. And where do we go to find that particular data on how seniors are affected? Because I know the states don't have to report it.
That's an interesting question. I'm not sure where that data is.
Because CDC will say, oh,
Is
this
it-
many children.
Yeah.
Because that's what they're required to.
It's indirectly calculated. The CDC,
Okay.
because it's not reportable, and in fact, the pediatric deaths is not the total number, it's just from I think it's 28 states report their pediatric deaths.
Okay.
So it's an indirect calculation. They calculate the excess of deaths that are attributed to influenza and pneumonia over the death rate for that particular week of the year, the known death rate. It is not an exact science, which is
Yeah.
why you get this range of numbers. It's
Okay.
anywhere between 4,000 and 48,000 deaths a year. There are no precise numbers.
And seniors, by the way, get a different flu vaccine. There's a
Yeah.
high, it's not just a high dose. I mean, it's
Yeah.
there's I know, because my 87-year-old mother got it. It's expensive. It's a lot more expensive than
They
your average.
charged for it?
Yeah, I know.
Is it a grandfathered health plan?
I don't know what, no, it was given, she's in an assisted living facility, it was given by them, and it said you couldn't submit to Medicare. There's sort of a strange, and it was like, I mean, it wasn't hideously expensive, but it was like $60. And it's like, really? The doctor doesn't come and do that? But, she lives in a small group home with,
Yeah.
8 other seniors, and I would just as soon she'd be protected. But yes, I didn't have to pay for my flu shot, but I had to pay for her flu shot.
Julie, can you talk about the relationship between the ICP and the VAERS?
Yes, and I was actually just thinking about that when she asked about it. One of the things that I neglected to mention is that the legislation that was passed in 1986 created the reporting system for adverse vaccine events, and that's basically how they establish and change the table. And if you get on the CDC website, you can actually look at the table and what the table injuries are and what the compensation is. But that was something that was very important, and it actually, in some ways, it came out of some of the complaints that parents had at the time. It's funny, 25 years ago, the concern was the DPT vaccine and was the pertussis part of that vaccine causing problems. And now, of course, we've moved over to the MMR vaccine. It's like, so things change as we go forward. But one of the things that parents wanted was a better way, more research and data on adverse vaccine events. So they did create the vaccine reporting system, and now all adverse vaccine events have to be reported to. I guess I'm trying to remember. Does it go straight to does it go to State Departments of Health and then to the CDC, or straight to the CDC?
FDA goes to FDA.
Oh, it goes to FDA. That's right. It goes to FDA. Yeah, there are a number of organizations involved in this.
You have to be really careful. Can I jump in for a second? Be really careful with those data. So VAERS is co-run by FDA and CDC, and anybody can report anything to VAERS.
That's a
So I
very
can
good point.
And my dog gets hit by a car, and I make a VAERS report, it's going to show up, And then often it's called a passive reporting system, which means it's dependent on people making reports. And an FDA commissioner a couple of decades ago made a comment that passive systems pick up about 10% of reports. Not about VAERS, not about vaccines, just a general statement. So what you frequently see and what you're going to hear from people is, well, if Dan's dog got hit by a car, then really 10 dogs got hit by a car. But it's not that. It's, these many deaths were reported, and the true number is multiplied by 10, and it becomes really scary really quickly. The system has some value in detecting signals, but it can't answer questions of causality, so it can't tell you whether or not a vaccine caused an adverse event. So just as a reporter, be very, very careful with, we need to write a paper, the good, the bad, and the ugly when it comes to theirs, because it can really be misrepresented. And there's other systems that can answer those questions much better.
Thank you.
Yeah, really good point.
Yeah, that is an excellent point. But it does exist, and it was created as part of this 1986 legislation.
Are there any other questions for Julie? Because if not, I think we can just sort of segue right into our our next bit because we have Dr. Solomon and Laura Helmuth right here. And is everybody okay with that? Okay. And maybe we just do this sort of informally. We're all sitting here. You guys can even stay where you are. Because my goal in this next session is to sort of look forward a little bit. Say, okay, now we know a huge amount about measles. We know a lot about vaccines. We touched on the controversy around vaccines and how it developed. And we know that there are pockets of vaccine hesitant parents in the United States that have contributed to the current outbreak of measles. So what I'd like to do now is sort of look a little bit forward. How should pediatricians and other healthcare professionals and the media talk to and about vaccine hesitant people and the rest of us about vaccines? How should we be approaching this as reporters and as health professionals? And how is all of this affecting our politics? We're hearing presidential candidates talking about it, other sort of cultural elements of our society. And to help us with that discussion, we've got Laura Helmuth from Slate. She's the science and health editor at Slate. She previously was the science editor for Smithsonian Magazine. And she is vice president of the National Association of Science Writers and also a doctor of cognitive neuroscience. Just thought I would throw that in. So it's actually Dr. Helmuth. I apologize for that.
Not a real doctor.
And we have Dan Salmon, Dr. Salmon, who is the deputy director of the Institute for Vaccine Safety and an associate professor at Johns Hopkins Bloomberg School of Public Health, based in Baltimore. And he is primarily interested in preventing childhood infectious diseases through the use of vaccines. He has focused a lot of research on how to talk about vaccines, why people refuse them, and so this is a particular area of specialty, and I really appreciate your being here to help us with that. So Laura, why don't you start, and then we'll move from there.
So I have a PowerPoint just to show.
Oh, great.
some
Okay.
I can move
headlines,
around.
just to remind myself what to talk about.
All right, well, the computer is up. Let me just turn on the projector. And then you can stand here and just advance
Okay.
slides there. It might be the easiest way to do it. Awesome. Oh, do you see?
Oh yeah, I
this?
see it. Thank you. Didn't you remember how to run the slideshow? Just nope, that's not it. F5.
I think
I knew
F5
there
will
was a
start.
special code. Yes.
Yeah,
Oh yeah, there you go.
you got it.
Yeah. Okay. Good. So some of what I was going to cover we've already been over today, so I'll kind of go through that quickly or skip it. And I'm just going to show some of the stories we've run in Slate and talk about some of the issues we've been dealing with lately. As we've talked about, there's a huge variety of rules in different states. In this map, West Virginia and Mississippi stand out for basically saying unless you're really sick, you have to get a vaccine if you want to go to school, no exceptions. And then the green ones have religious exemptions, which can mean all kinds of things. And the blue ones are personal belief exemptions, where you just really don't want to get your kid vaccinated. And the orange ones are both. So you can see there's kind of a range, but in most parts of the country, if you don't want to get vaccinated, you don't have to. If you don't want to get your kid vaccinated, you don't have to. So one of the questions we asked is, all these states have religious exemptions. Why is that? Because no religions say you shouldn't get vaccinated. It's a ridiculous policy. Basically, the only two religions that have anything to say about vaccines negatively are Christian Scientists, and even they don't have a strong stand against it. In general, Christian Scientists are suspicious of modern medicine and say that it interferes with your relationship with God, but not for vaccines. They basically say, go ahead and get vaccinated, do whatever you have to, go to school, and if there are adverse effects, pray to God to get you through it. So they're not exactly enthusiastic about vaccines, but they're not against it. And then you also have, so the Jehovah's Witnesses, who you have problems with blood transfusion, fine with vaccines, nothing against it whatsoever. There used to be a bit of an objection from Catholics because some of the early research on some vaccine lines was done in cell lines that were extracted from fetal tissue. But I think this is something from the Philadelphia College of Physicians had a nice story about this. Basically, the American bishops said, in general, we don't want to encourage any of this sort of research, but get the vaccine. There's not a problem. There's no reason you can't get it. And then the Amish we talked about a little bit have had some outbreaks. And I think I have and with the Amish, it wasn't that they were particularly opposed to vaccines, just in general opposed to modern medicine, modern life. But there seems to have been much more uptake of vaccines since a really nasty measles outbreak, because they don't have any theological objections to it, most of them. And then the other kind of pocket of religious objection is the Dutch Reformed Church. And I think last year and the year before, there was a nasty outbreak in what's called the Dutch Bible Belt, where people who thought that medicine interfered with your relationship with God were against it. But even they have started getting vaccinated after having actual measles. So it's one thing to be sort of, in principle, theologically opposed, but really no religions are against it. So the more we look into this, the more sort of absurd the religious exemption is. Let's see. So, but you still have places, of course, like Vermont. This was sort of horrifying a couple of years ago. People tried to tighten the rules for getting exemptions in Vermont. One of the co-sponsors was Warren Kitzmiller, was a big supporter of the bill, one of the state representatives. He had had polio as a child. And so, of course, he was going to support a bill that would make vaccines easier, more necessary to get. But the anti-vaxxers got to him even. They got to everybody in the legislature, and even he ended up voting against the bill because he'd been lobbied so hard by the paranoid anti-vax parents, who are much louder than the pro-vaccine parents. Unfortunately, even though they're massively outnumbered by people who are for vaccines, they're very, very loud. And then, so we've talked a little bit about Jenny McCarthy. The other person who is the big problem here is Robert F. Kennedy. Does everybody know that he's a huge anti-vax activist, a horrible human being? So
You're on the record here.
I'm on the record here. I think I call him literally a horrible human being. This is me. I don't usually write. I only write when I'm really worked up about stuff because I'm an editor, and so I like to have other writers write for me. So if anybody ever wants to write for Slate, please talk to me. But sometimes I just get mad, and then I have to write myself. And so we had a little blog post by an astronomy blogger talking about how irresponsible it was for Robert F. Kennedy to be saying that vaccines are dangerous, which he does regularly. He gives talks all the time and says that vaccines cause autism, and he's still saying it. Even not just before the Wakefield thing was completely discredited, but this was 2 years ago, I think, a year and a half ago. Anyhow, so we described him as an anti-vaxxer, which is shorthand for people who say that vaccines cause autism. And he got mad, so he called to complain. And I said, well, if you have any corrections to the story, please email me, and I will make the corrections immediately if there's any factual problem. And he kept calling and kept calling, and I kept not taking his calls because he's crazy and wrong, and I was busy. And so he called a good friend of my boss, who then called me and said, if Robert F. Kennedy wants to talk to you, you have to talk to him. So I picked up the phone, and he talked, he just talked at me for an hour. I mean, I've got a recording, and so throughout the thing, I'm like, well, wait, and he just kept talking. He just you push a button and he just goes. And he's got this whole rant about how vaccine makers are making vaccines in order to make money, which is interesting that they actually don't. It's not their big profit center. That the Centers for Disease Control and Prevention is hiding evidence of a massive conspiracy to poison children. And scientists are participating in this because it would interfere with their research funding if they revealed this terrible secret. It's just this outrageous conspiracy. Oh, and journalists are too afraid to report on this conspiracy because we don't understand science. So those were kind of the 4 parts. Yeah. So those were sort of the 4 points of his thing. So, and when he talked to me, he gave me all these names of specific epidemiologists, vaccine makers, scientists of various kinds, who he said told him off the record that they knew that vaccines were poisoning children. And so I called each of them up, and I said, okay, Robert F. Kennedy Jr. said you say vaccines were poisoning children, and you told him, and then you lied about it. And every single one of them said, oh, that guy, he completely misrepresented everything I said. He lies. He's just lying. And everything he said was a complete lie.
Why?
It's crazy. Well, I mean, there's the psychological explanation, which is that, once he bought into it early on, Which, you know, he when he started with this, it was after the Wakefield paper, and people were, you know, had a legitimate question about, could, you know, autism's going up, could it be because of vaccines? But he like got himself into this conspiratorial worldview.
Yeah.
And I think there's some Messiah stuff going on, and also I think he's a little unhinged. So I had like a slight qualm: is he mentally ill? Do I need to do this? Is that wrong? But he was saying such awful things, and says them all the time. I mean, he's literally accusing scientists of poisoning children. So anyhow, and he gets a lot of attention because of his stupid name. Anyhow, so if you ever have to do a story and he talks to you, this is how I recommend. You know, if you have to talk to him, just fact check him and, you know, make it clear that he's just batshit crazy. And now he's horrible. He's just horrible. We've dealt with him a few times.
We can tell now.
Yes. Most sources I love are just, you know, incredibly generous people, but he just, anyhow. And then he started talking about all these other conspiracies, and, you know.
Laura, did you bring your blood pressure medication?
I've been drinking coffee all morning. So so aside from him, like, it's amazing what sort of generosity and kindness you can find even in these times where people are very agitated. And so another of our writers at Slate, his wife's an epidemiologist. He knows a lot of pediatricians, and so he did sort of this informal survey of about 50 or 60 pediatricians who, you know, he knew through like 4 or 5 degrees of separation, and asked them basically, how do you handle parents who don't vaccinate, and, you know, what do you think about, what do you really think about it? This is anonymous, tell us what you think. And he was expecting people to be really mad, and, you know, we would have run with that like crazy. But they were super kind about it, and all the pediatricians he talked to said that they blame themselves. They're incredibly patient. They said they felt like it was a failure of their own, you know, clinical process that they couldn't reach these parents, and, you know, they were very regretful when they had to, in some cases, tell the parents that they couldn't be in their practice because they didn't want to expose their other patients to unvaccinated children, and, you know, they just tried over and over and just kept trying, and they're in the front line, and they said that many of them reported to him that often what will happen is parents will come in with questions about vaccines, will feel sort of uncomfortable about it, the whole needle stick thing will scare them, and but many of them are susceptible to, you know, facts and persuasion, and just this is, and I think there was a study that came out recently basically saying that if doctors presented as, oh, this is just the standard of care, there's really nothing to worry about, it's, you know, you've heard things but they're incorrect, just flat out, this is how we care for children, this is how we keep children safe and the world safe, and that seems to be fairly effective. So there is like a lot of generosity and decency happening despite the incredibly frustrating ignorance and misinformation campaign. And then two things I want to say about this. One, we've tried to change this. The needle stick into a baby, try not to use those pictures if you can. And so I've been going back and forth with our art department. It's really easy to find these stock photos of kids getting vaccinated, but it apparently just pushes all the buttons of parents who are scared about vaccines. So there's been sort of a pushback, especially on Twitter. We for another story on vaccines, we showed a baby being vaccinated and screaming, and people complained on Twitter, and I got our art department to change it. But it was something, like, I think probably most of us are not squeamish people. You know, we've seen, you know, vaccine lesions, we have pictures, and, you know, we don't mind this stuff, but apparently that's kind of a trigger for people who are scared about vaccines. So if you have any say in your art department, it can keep them from doing what we just did here to try to get them to find other art. But the other point of this is that, so basically the parents who can be persuaded by their pediatricians are being persuaded by their pediatricians. The parents who, like, understand data already understand that they should get vaccinated, and so what you want to reach is the people who are scared of vaccines. Yeah, go ahead.
I just wanted to find out if the pediatrician had any remarks about parents who are not sold on the vaccination schedule, and, you know, they say, well, no, we don't want to have all this at this time. Did he or she say anything about that?
Oh, that's a good question. Yeah, so unfortunately, so I just edited the story. I didn't actually do the hard work, so I'm not sure what if they got some stories like that. That's a really good question. Yeah, I imagine that the answer would be the same. Just, this is the standard of care. This is how we do it. But yeah, I don't know specifically how they handle that question. So then, so, yeah, as I was saying, certain stories reach certain people, and fact-based stories reach, fortunately, the vast majority of parents. But then there are those who are still freaked out about it, and so what is really useful is anecdotes, unfortunately. It's not the best way to convey information, but it's sometimes the best way to get people. And so this story, I don't know if you can see the little Facebook thing there's been shared 865,000 times, which is one of the most shared stories from Slate. And this is basically a woman saying, it starts out in the 1970s child of a health nut. I wasn't vaccinated, brought up with incredibly healthy diet, no sugar. Anyhow, and then she goes on for a few thousand words to talk about every single horrible illness she had as a child, and how it seems like this idyllic, Edenic sort of childhood of frolicking in the fields, but basically the fields are just swarming with microbes that will kill you. And so it's very effective. And she's very non-judgmental. She's from this world. She's saying this, my parents had the best of intentions. I love them. They loved me. But I was sick all the time. I was just constantly sick as a child.
I think I was one of the Facebook sharers of this.
Oh, were you? Oh, thank you. Excellent. So yeah, it seems to be this sort of thing can be fairly effective if you get rid of that poor picture. And then, so that story was from last year, January 6, 2014. And then this year we just published a story that, again, the story is an anecdote, this is an anecdote, but it's by a woman who was also raised by health nuts in the Bay Area, New Age, anti-vax people. And a couple weeks ago, she lives in New York now, and her mom called her up and said, "Honey, you need to get vaccinated." And it's 30 years too late. She should have been vaccinated when, before she went into kindergarten. But she has memory of every year going into school and bringing in a note saying, "I have religious objections to vaccines," which she had no idea what that means, and neither did her parents. But so 30 years later, this outbreak made her mother scared that she would get measles. And 30 years later, her mom was feeling like, I guess I should have vaccinated you. Sorry. So anyhow, it's this long story about how she was, and she hadn't really ever thought about it because, she hasn't encountered measles as a kid or as an adult. And so she started reading up on it and, got really paranoid and went and got a vaccine, and she was afraid that the doctor would look at her like, "Oh, I can't believe you," would be judgmental that she was now, mid-30s getting vaccinated. But at the CVS, the people who gave her the vaccine were just like, "Okay, great, we're running out of these. Everybody wants them, stab," and she's done. And so it's kind of a hopeful thing that, maybe we'll see. I mean, it's way too early to know from the data, but it's possible that this outbreak is actually reaching some people who hadn't been reached before. And that's